Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we're moving into our first conversation for today. This is our COVID-19 update. And one of the important things we wanted to share with you before we get this conversation started is that as of last night, there was a 22nd case confirmed in Belize. That person has been identified as a male person who was caught entering the country illegally over the weekend. And at this time, case 22 is in mandatory quarantine. However, there is contact tracing that is taking place to find out who he came in contact with and whether they will need to be tested. So that's where we are as of this morning. Case number 19 has officially tested negative and is considered recovered. So there are 3 active cases, 20, 21, and 22. And this is, of course, a great backdrop for this conversation because it will really help us to understand why we need to keep up with the science of what's happening with testing and treatment and vaccine development. And here to have this conversation with us, we are joined by Dr. Jorge Hidalgo. Good morning.
Good morning, sir.
Good morning, and thank you to invite me.
Doc, we're really grateful you woke up early to talk with us. But, you know, it's such a critical, it's a great time for us to take a pause and look at the science of what's happening. Because there's a lot of conversation about testing, rapid testing, vaccine development, treatment options, and it is a very complex subject because a lot of it is very new. So let's start off. I'd like to start with the treatment options that we know so far, and also the very unique way that the trials have been done across the world.
Yes, well, thank you. And then, well, unfortunately, until this day, the treatment has been very, very challenging. We initially, at the starting of the pandemic, we say, okay, the hydroxychloroquine, it probably is be promising at that point. Then the study shows that it's not a good option because of many side effects. No? Mean that hydroxychloroquine is already not a part of the protocol of treatment. Then several clinical trials and as basically we call it a tsunami of papers published, some of them due to the urgency of the pandemic were essentially reviewed poorly. Meaning that actually some of the most important journals like Lancet, they need to retract it on some papers and then put it back. In that treatment options have been very challenging.
Yeah, this is, I think, and I've been saying it for quite some time, the greatest challenge I know some of us have is that we are learning and discovering the science along with scientists. And so this process of saying something might work and then coming back and saying, no, it doesn't work, or saying something is not helpful and then coming back and saying it is helpful, really leads to confusion and in some cases mistrust. But it's important that we understand the process that is involved in scientific testing and vetting of whether it's treatment, vaccine, or even tests. Do you want to explain that for us, Doc?
Sure. Well, when just essentially to tell you in terms of treatment, at this point there are no any treatment approved. There are definitely many options and supported treatment. I mean, at the base of what we do right now with patients with COVID-19 is trying to be essentially support all the different organs as we see are failing in the critical cases. And then we have just lately yesterday we have a paper that steroids like dexamethasone, that is not a new medication, but it seems that it will help with the inflammatory response, because the most important part for patients that are critical ill is that the body, it creates, as we mentioned already, a very disorganized and powerful inflammation in the body that needs to be controlled.
Yeah.
That's dexamethasone is promising that is in help with the control of the inflammation response. When it comes to testing, it's very challenging. For all up to now, June 17, the gold standard testing for acute cases is PCR.
Yeah.
And of course, as the U.S. approved more than 180 different testing as an emergency, only few of them are validated. That means that we say, okay, we can use it and it's going to be helpful.
Yeah.
But in terms of we have a rapid test for acute phases. Until now, there are several tests, but no one is being validated and say this can be used as a gold standard.
Yeah. Or most accurate too, because there's a lot of accuracy issues with the rapid test.
Yeah.
So
Exactly.
there's a process that I think is really interesting, and it when we see international news reports, especially, we just see a headline saying this medication is being tested, and it gets us very optimistic. But there's a process in how studies are done to really be able to know whether these medications are working. From what I've read so far, there's the Solidarity study that the World Health Organization initiated, where people are trying out these medications all over the world, gauging reactions. And they seem to be starting with medications that or treatments that already exist, not necessarily the development of new treatments. How do you explain this to people as to why it takes so much time, and why you can't just trust that because they're seeing if it works means that it'll actually work?
Yeah, the most probably good example is what we are doing with vaccines. There are approximately 160 vaccines that have been tested at this point. And unfortunately, this take a process. The clinical trials usually go to phase 1, then essentially we tested in non-humans. No, we tested with animals, with, of course, the correspondent permission from the animal society. And then if we see that there are no problems in that phase, and that phase it could take between 3 to 6 months. And then we go to the second phase, when we start to do testing in a small group of humans to see exactly, of course, with the correspondent permissions and all the papers be signed, understanding what we are going through. And then when this second phase it goes successfully, when we can go to the phase 3, that essentially includes a huge number of humans. The vaccine is going to be, or the medication is going to approve. I mean that it usually takes between 12 to 18 months for a vaccine to be approved. I mean that, again, we have 160 in different countries in different phases. Mean that we'll see. We hope by the end of 2020 we will have a reliable vaccine.
Yeah. You know, I love that.
I think what you clearly explained in terms of the months of testing is key, because there's developing something that looks like it'll work in a petri dish, but then you have to gauge reactions on human beings, and you start with animals first, and then different categories of human beings. I mean, even from the healthy to the more vulnerable.
Yes.
And so that is that why it is such a long process?
Yes, because again, unfortunately, each person will react different to a vaccine. Or probably I will take the vaccine good, but somebody else will have different side effects. I mean, we need to make sure that the big group of patients, it will tolerate the vaccine well, with minimal side effects before something can be approved. No?
Yeah. I tell you what, Doc, I really appreciate the fact that you have cleared that up, and you've given at least a duration in terms of what it's like before something is actually found. Because, you know, going on social media, there are a lot of things on there, and a lot of people are actually reading these things thinking that, you know what, it's actually out there and they might not be saying anything. It takes some time. I want to get back to the rapid testing though, because we know that our country is we're trying to get things back open up, and in terms of the economy, we're looking more to opening the borders, especially the airport, because our country bank on tourism. In terms of rapid testing, what's the accuracy level of this? Because I think that's where we're trying to go.
Yeah, well, there are two important things that we need to know. One is the sensitivity, and the other one is the specificity of the test.
Yes.
That plays an important role. And unfortunately, none of the rapid tests at this point have a good specificity compared with the PCR. Then that is an important thing. As I told you, there are more than 180 different type of tests approved by the FDA as an emergency, but none of them have been validated. Meaning that the first thing we need to do is trying to validate if the rapid test we will use is comparable with the PCR. And I will tell you, that in Belize we have in the PCR we have most of the more modern, that is the Roche machines. No, we are using Roche technology, and that is with a lot of confidence. It takes time. There are some PCR technologies that they are developing that can provide information in 45 minutes. No, that, and I believe that is at this point the gold standard. We have different type of rapid tests that it can be used basically at the end of our sickness to see if we have developed antibodies or not. But in terms of if we can use it as an acute phase, at this point there are no rapid tests approved.
Yeah. You know, and I think that's maybe a challenge for us to be able to understand, because, you know, in the United States, for example, we know there are rapid tests available. People can go to CVS and get a test, or a parking lot and get a test. And you said something really critical there, that the FDA, the Food and Drug Administration, actually okayed rapid tests at a certain level, but it hasn't been validated. How do you explain what that means?
I mean that essentially you take some of the rapid tests and you compare with the PCR and to essentially see if the sensitivity and the specificity are okay. The PCR have a sensitivity of 99%. Right. That means a specificity. That is most important. Because some of the tests could be very sensitive but not specific. Those are the two terms that we need to essentially work with. It isn't some of the tests, like tell you that the PCR depends on it could give you some false negatives, but it depends on the moment that you take the sample. If you take the sample too early, it could be that it's going to be negative. The virus have something that we call it a replication, meaning that the time that the virus is going to be active in the body, and the initial phase it could take 2 to 3 days. If we take the test too early, probably it's going to be negative. Mean that also other things, if we take the sample too late, or we take the sample relation is not good, then those things can interfere with the results. Mean that for the PCR, we use oral, nasal, nasopharyngeal, and if the patient is in ICU, we can use a bronchoscope and collect samples directly.
That's that long Q-tip that you put all the way up the nose, right?
Yes,
Looks
yes.
painful.
I mean that lately there are some new technologies that they are developing using saliva that is going
Okay.
to be less uncomfortable, because I don't know if you already experienced the nasal test, but
We've seen it.
I have not, and I do not want to.
Well, I experienced myself, and tell you, you need to put take the sample and go and take it for 10 seconds, running
Ooh.
left to right, and that is very uncomfortable.
But it looks like especially for that Q-tip testing, it looks like it's being shoved all the way in. Is there a specific area of the nose that should be touched to get what you need, or swab to get what you need?
Yeah, we need to go as much as we can inside, essentially, until we see a resistance. When we notice a resistance, then we need to run the swab for 10 seconds, be right to left, to trying to have the most sample as we can, to be able to be accurate.
Yeah.
And if this sample is not taken properly, then we can have some false negative, so false positive.
Yeah.
Wow.
But so, there's a lot of information. So you're saying that, and we've heard it repeatedly, that what we've been using in Belize, the PCR testing, this type of diagnostic test, is seen as what is called the gold standard. It is more accurate. Did you say 99% sensitive?
Specificity for specificity is 99%, and then that's is much better, no?
Yes.
Because tests can be very sensitive, and then that's not it don't give you the accuracy, but if the specificity is the most important one, because then can tell you, okay, this is the specificity for the PCR is 99%.
Yeah.
I mean
and while it is, seen as the most accurate test right now for COVID-19, the drawback for it is the turnaround time for getting the results. It's collecting the sample, getting the sample to the central lab, processing, testing, and all that takes place there. So it does take a bit of time. I think what we're looking at is about 24 hours. I
think so. The test itself takes the processing of the sample. It takes 8 hours.
Wow.
An average, no?
Yeah.
And then of course, we need to the different persons in charge in the lab that are doing an excellent job.
Yes.
They need to essentially log in the patients, do the processing, and then they need to if they are going to release a sample, they need to have approval for the supervisor to making sure that we are delivering a good results. I mean, that takes a little bit of time, but I tell you, we have good technology because we are in Roche.
Absolutely. And so where the conversation starts about looking at other types of tests is when we have people who will be traveling into the country. But at this point, is there any individual rapid test that looks promising, that its accuracy is better than the 40 to 60% that we hear used very often?
Well, Abbott is developed a machine that is PCR, and it delivers the results in 45 minutes. No, I mean that is I can say the most promising and accurate results. No, and then there are many tests, rapid tests that is in the market. But again, until we are not, those tests are not validated with PCR technology in terms of specificity, we need to wait a little bit longer.
And that would be multiple tests per, or because when we say 45 minutes, and would that be like one person, or would that be multiple tests?
No, one person. Wow. Right now, but it's a small machine, a small technology that Apple developed and it's been used in the US. And there are other companies that also develop certain PCR technology that can deliver those tests, those results in such period of time.
Yeah. You know, and I was just going to say that, you know, we have learned firsthand now with our experience here in Belize where rapid tests can in fact give you false negatives, or case number 19 and case number 21 had taken rapid tests and then tested positive with our PCR test here in Belize. So, you know, it shows how cases can be missed because you get a false negative from a rapid test. So, go ahead.
Sorry, and that's exactly the problem, no? That we can have either a false negative or a false positive results, and that's the problem that we are still dealing with this type of technology.
Now, when you look at the amount of research and the amount of time that scientists are devoting to these three areas, testing, treatment, vaccine, do you think that it's going to be a faster process to be able to get a more reliable rapid test or less time in processing a more accurate test or a treatment? Do you think that because it's a globally urgent situation, it may take less time than we normally see?
Well, that's exactly is happening. I think so. UK is already entered in phase 2 and phase 3 trial for the vaccine, and I think so. Probably that is something that we will have hopefully by the end of the year in terms of vaccines. In terms of rapid tests, well, everybody is working hard right now to try to have something that is going to be in time, less time, and accurate. And in terms of treatment, there are many trials going on with different type of medications. Nothing new, but essentially using medication that we used to be using in different conditions, but trying to apply on COVID-19. Again, some of the treatments like hydroxychloroquine are removed from the protocols. There are several, like remdesivir, that is and the dexamethasone at this point are the most that's basically promising treatment. That and then there are many other medications that it's been basically on trials to see if it can be good in the part of the protocols treatment of COVID-19. I mean that so far right now, for the critical ill patients, basically the support treatment, trying to the different organs that are failing, trying to control the inflammation response, and dexamethasone is a very affordable medication. This is the basic latest trial that is going to be promising as part of the treatment.
Now, your words will be different as a medical professional. Promising doesn't mean it works, or we're sure it works, right?
Exactly. That's correct.
Because we don't know what kind of side effects it may have on different people, ages, races, and underlying conditions.
Exactly. That's exactly, because as I told you, unfortunately, everybody will react different to different treatments. I mean that's why the phase 2 and phase 3 of the trials is important, because we essentially trying to recruit as much people as possible to try and the best information we can, especially related with side effects of the medication, and we can enlist it and say, okay, this group of people react in this way, this race of people react in a different way, and that's the importance of phase 3 trials.
Do you know, Dr. Hidalgo, just out of curiosity, the clinical trials that are taking place for treatments and vaccines, you know, a critical part of reactions usually has to do with your racial background as well. You know, sometimes Caucasian people are more prone to something, people of African descent may be another. Do we know of people who are within this region participating in the trials so that we can kind of know, or reaction here as well? Or does it matter?
Remember that one of the things with the phase 2 and phase 3 trials is that they don't share any results, also they don't release information until the trial is finished because of confidentiality. I mean that, but again, as I told you, the most important thing is that in those type of trials, they're trying to recruit different races, different ages, and sex to be able to have an important idea about what is going to happen in different groups.
Doc, how do we talk to the public right now? We are about 6 months into the discovery of COVID-19.
Yeah.
And basically, where we are, there's no treatment, there's no vaccine. We can test for it, which is a great thing. That's a great first step. But it leaves so much uncertainty for the time ahead. Based on what the science is saying right now, what do we know that can be a sense of comfort to people?
Well, the most important thing, is that we can't not relax at this point. We need to ensure our social distancing measures, hygiene. That is for right now the most important thing. We cannot say, okay, in Belize we are okay, we can go out without our mask or without taking the different measure that we know that we need. I think so. That is the most important measure. We can't relax. There are no medication available that we can ensure that it will work. We don't have vaccines. The most important part is our social distancing measure. Please don't relax. Because we are okay right now, but the virus, we still, even that at almost 6 months or a little bit more than 6 months, the virus came out, and we still not understand completely how the virus behaves. And as you can see, it behaves different in countries, and in the US, it behaves different in the stages, mean that in the states, no? Mean that we just must take our precautions measures.
Doc, and finally for me would be that does weather hinder anything about this about COVID-19? Does it matter, the weather?
Well, at the beginning they say that in temperatures like Belize, the activity of the virus is going to be less compared with areas where the temperature is cold. No, apparently they say that, and again, it seems to be that this is the case. Also, probably you will read some articles in Italy and Spain, and some of them, the scientists in Italy is saying that in Italy the virus at this point is like getting old, and his capacity of infectivity is less than they saw in the group patients that they have the opportunity to see in March. They compare with Spain, and they see that the virus is behaving in a different way. Of course, this is we need to have more information, but it's some articles that probably you will read, that the behaving of the virus in Italy and Spain is different. It's not as aggressive as they saw in March.
That's interesting.
Wow, very.
In fact, there's been quite a bit of mutation of this virus since its discovery, right?
The ability of this virus to mutate is one of the most important things. I just want to mention, it's a little bit, we're trying to simplify, but
yes,
this is a type of virus that we call it an RNA type of virus, and the type of the size of the virus, this particular virus is bigger than the normal RNA viruses. I mean that these viruses have the ability to have a huge amount of mutations that in normal circumstances it causes to this virus to commit suicide itself. But the virus is behaving as a high species and have the ability to control the mutations. And one of the important characteristics of this virus is his ability to replicate. And that ability to replicate, it allows him to essentially move from different species. As you know, at the beginning, they was related with the main reservoir are of course the bats, but the intermediate reservoir they mentioned the pangolin, not this animal that is bring from Malaysia and basically entered China illegally. But those are one of the things that this virus have, his ability to replicate and to also to move from the species.
Wow. Still so much to learn.
I know.
And I don't want to lose the opportunity to allow you to reiterate. Well, before that, what is the most interesting fact that has been discovered so far about this novel coronavirus that stands out to you as a critical care specialist? You would deal directly with patients. I'm sure you're following all the literature. What stands out to you the most?
Well, the most important aspect of this virus is his ability to replicate and to move from a species, and again, his ability to control the way the virus move.
Yeah.
That's the most important thing that I think so. It caught our attention.
Yeah.
In terms of the cases are with no mild symptoms or completely asymptomatic. A small group of patients, it will develop a moderate infection, and 5% it will end critically ill in the ICU.
Wow.
All right, and we still
Interesting.
hear people talking about long-term effects after COVID-19 as well, with pulmonary problems long after they've been tested negative.
Yes, remember that in a critical ill patients, the patients it will spend an average of 2 up to 3 weeks in the ICU with different type of medications. And then before COVID-19, we was focusing on the post-critical care syndrome. No? That means that due to the fact that they are in ICU, they can have some nightmares. They can have a muscle weakness, difficult to remember things. Mean that the post-ICU period, it has an impact in people, and some of the things at the level of the lungs, we call it that some of the people that they spend more of the time, they can develop something we call it pulmonary fibrosis. No? That it basically also put a lot of stress in the body because they require oxygen for some period of time at home. And in some really bad cases, they will probably be dependent on oxygen for the rest of their life.
Yeah. All right. And I guess to close off with a silver lining, we do have control of the spread in our individual actions. And there's a lot of public health measures that we do know, the science does show, will work. If you were to rank them, Doc, how should we be behaving in terms of how we protect ourselves?
Well, we need, again, to stress on our hygiene measures. If you go out, please wear your mask, but wear your mask properly.
Yes.
Because you know that unfortunately there are people that they are wearing the mask in improper way. You know, I mean that cover your nose, make sure you cover the nose and the mouth, because some people just put the mask as a protecting the mouth, but we need to use our masks properly. And I think so that is the most important message. We can't relax.
Yeah.
The virus is knocking our doors in different borders, and we need to be basically extra precaution about it.
And keeping social distance, still very
Yes.
critical, and
Is
washing hands.
Exactly.
All right. Dr. Hidalgo, we really appreciate you joining us this morning and breaking down a lot of the complex science behind COVID-19 and the research that has been ongoing. Thank you very
Thank you.
much.
A pleasure. Have a nice day.
All right.
All right, and excellent conversation there. The conversations continues following the commercial break. We'll be venturing off into a conversation with the Social Security Board and online scholarship process. Stay with us. We'll be right back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.